I'm very excited about this next session. I think it's going to be a great capstone to the day, and that we have two very distinct law degree from the University of Cincinnati. His first job in government was with the Bureau of the Budget in the state of Illinois. And he served as an elected official in Ohio for 30 years as a member of the state legislature, a county commissioner, Ohio Secretary of State, and then most recently as governor of Ohio from 1999 till 2007. In his role as governor, he focused on improving schools, reforming Ohio's tax system, attracting advanced high-paying jobs, and helping communities clean up polluted sites and provide better recreational opportunities for their citizens. Governor Taft is currently a distinguished research associate with the University of Dayton, where he teaches political science courses and working with state and federal internship programs. He serves as an honorary chair of the Appalachian Children's Coalition. To Governor Taft's right is Governor Ted Strickland, who is he's a local boy from the Lucasville area and grew up in Scioto County. He's a strong advocate for education. Governor Strickland graduated from Asbury College in Wilmore, Kentucky, later earned a Master of Divinity from Asbury Theological School and a doctorate in counseling psychology from the University of Kentucky, I believe, correct? I'm not sure why you didn't go to school in Ohio, but we'll forgive you for that. So, Governor Strickland has held numerous positions in both the private and public sectors. An ordained minister, he served in ministerial positions and worked as the director of a Methodist youth home. He also taught psychology courses at Shawnee State University in Portsmouth, Ohio, and worked as a counselor in the Ohio prison system as well at Southern Ohio Correctional. Am I correct? That's right. You think? He served several terms in the United States House of Representatives, representing Ohio's 6th Congressional District. While in the House, he was a strong advocate for job creation in Appalachia and has also emphasized more federal funding for education. Governor Strickland served as Ohio's governor from 2007-11 and continues to advocate for Ohio's residents and serves as an honorary co-chair of the Appalachian Children's Coalition. And just as a personal aside, I don't know how many of you lived in Ohio from 1999 to 2011. Okay, so a lot of you like me, I lived through this, and I can just say, having lived in Ohio during their terms as governors, and at the time today where there's a lot of cynicism about our leadership, I think these two gentlemen really reflect 12 years of incredibly principled leadership for the state of Ohio. And exactly. Yeah. And today, having a chance to interact with both of them, they both continue to stand, I think, as shining examples to those who aspire to public service. And I'm just so excited to have them with us today. What we're going to do is I'm going to feed a series of questions to the governors and really asking them to offer their perspectives that reflect both the period of time, the time that they were in the governor position, but also that's informed by their strong continuing interest in the welfare of children in our state today. So I'm going to invite them to make some comments on various topics. topics, and we'll allow some time at the end if you have questions or comments that you'd like to make as well. And I want to start just a bit by going back to the past a bit and asking each of you if you could just give us some sense of what was your sense of the needs of the Appalachian region when you assumed the governorship? And what were some of your priorities that you held then in terms of attention to or investment in the region while you were governor?
I'm going to stand because, can you all hear us in the back? My perception of the needs grew out of my own experience because I grew up in the foothills of Appalachia, Lucasville, Ohio, and I came from, I guess, what many would consider a typical Appalachian family, in that out of 9 kids, I have 8 siblings, there were 9 of us. One of us finished high school other than myself. So, and that was my brother Roger. Of course, none of us went to college. And so I grew up with certain values, obviously, family values and sense of community and appreciation for teachers and all that. But I grew up with no real sense of what life could be beyond high school, quite frankly. And so I think I understood Appalachia in a very personal way. But let me say that the thing that I most value, and I think is probably most valuable even today to young people in this part of Ohio, other than their immediate family and their parents, is the relationship they have with their schools and with their teachers. And I can say if I've accomplished anything in my life, it was possible because the love of my parents and the support and encouragement that I got from my teachers. And so when I was governor, I think I understood the needs of Appalachia, and especially Appalachian children and families. And, but I also had an appreciation for how one person or 2 persons or 3 persons in the form of a minister or a teacher or some other caring adult could have a magnificent, permanent influence on a child's life. And so that's all I'll say about that now. But there are a lot of needs across our great state, Governor, and we know this state well. Those needs, in some ways, are very similar, regardless of what part of Ohio you may find yourself in. But there are particular needs in our part of Ohio, in our region of Ohio. And I tried to be sensitive to that when I was governor, while understanding that my responsibility as governor was for, the larger state.
It's an honor for me to be here with Ted Strickland. If you don't know already, this is a bipartisan operation right here, which is really good, but we are very good friends, and we work closely together on a lot of projects. It's always dangerous to let former governors to speak. Our knowledge is a mile wide, an inch deep. That's governors. So, so take everything with a little bit of a grain of salt. I was governor from '99 to '07, so that was a pretty different time. And I knew Appalachia had great needs, and we focused on it a lot. We really stepped up the Office of Appalachia, but the needs we focused on were more the hard infrastructure type needs. I had a school funding lawsuit faced me when I came into office, based largely on the fact that the school buildings throughout Southeast Ohio, especially, were just deplorable. and an embarrassment and just dangerous in many cases. So we ramped up a $4 billion school rebuilding program that prioritized the poorest school districts in the state and provided, say, 80% of the money for those school buildings. So that has caused a big school rebuilding effort throughout Appalachia. And then from an economic development standpoint, new Appalachia was hurting economically distressed counties. And the thought was, if you don't have good transportation into Appalachia, it's not going to work. So we focused on building out that regional highway system, the 35 and the 33 and the 32, and completing that kind of work. The last thing I did was, because there was a total lack of philanthropic resources really in the region compared to other parts of Ohio, we seed funded with $1 million the first grant to the Foundation for Appalachian Ohio, which, as you know, has really run without money and got additional state support, a lot of private money. So I'm really pleased about that. But this time was before the opioid crisis, before the recognition about the importance of socio-emotional learning and the focus on that, certainly before COVID. So, now I think there's a much greater appreciation on my part anyway, and I guess everyone's, that we need to focus not just on the hard physical infrastructure, but we have to focus on, the mental health and the behavioral health of our children.
Thank you. So just jumping forward a little bit to today then, you both are still so incredibly active in a number of organizations and efforts that really are focused on supporting the well-being of children. What's your sense of the greatest challenges facing children in the Appalachian region today?
Many challenges facing children, but obviously poverty, in my judgment, is the single greatest issue facing many Appalachian children. We just have a lot of people who live on meager resources. Jobs are not plentiful. Many jobs that do exist don't pay a lot of money. And so there are just multiple issues and problems. And so obviously the educational needs are hugely important. The governor mentioned the fact that Ohio has an unconstitutional system of school funding, or that's what the state Supreme Court declared. I thought that I've solved that when I was governor by passing a law.
We all solved it.
Yeah. We passed a law with only one dissenting vote in the entire legislature, although it was, it was controlled by the other party from my party. But it continues to be an issue. And the problem is there's not enough money in Appalachia. There are resources in Appalachia, not enough jobs in Appalachia. The governor mentioned the school building issue, and that was a huge problem. And when you're a governor, you have to make decisions. And I made a decision that I got a lot of criticism for, because we had a tobacco settlement money, right? And I decided to put about $3 billion of that tobacco settlement money into building new schools, and I got a lot of grief from the anti-smoking folks, and I understood that. But when there are limited resources and you got to decide how to devote those resources, it seemed to me that in the long term, having adequate school buildings was really important, and roads and so on and so forth. When we had the stimulus money that came out of the Great Recession, I put the largest money that came to Ohio into building the Nelsonville bypass, and a lot of you use that. So we can't change Appalachia from what it is, what it has been historically. And there's a region that the Appalachian region, not only in Ohio, but across the large swath of this country, has been a region that has seen a lack of economic development and so on. Part of it's geographic, part of it's historical. It costs a lot more to build a interstate highway through Appalachia and hills and valleys and mountains than it may be to build a mile of interstate highway in Iowa or Kansas or some other part of the country. So there are reasons for that, but I think we've got to recognize the uniqueness of the region. We need to appreciate the history and culture of the region, and we need to understand that for reasons that are not positive, the region has been exploited by outside interests. Part of Appalachia, part of the Appalachian that we live in, has seen resources, natural resources extracted. Some people have, gotten really rich from using the timber and the coal and the oil and gas from our region. And the benefit of that wealth has not been reinvested in the region, as I think it should have been. So poverty, too much poverty, too fewer jobs, lesser education opportunities than exist elsewhere in the state. These are all intractable problems that need to be recognized and focused on if the region is ever going to have the opportunities for our children that exist in many other parts of the state.
At the risk of sounding like a front man for the Appalachian Children Commission, I'm going to say the circumstances in which so many children are growing up and the lack of care for those children. One stat that Randy likes is, it's not a good stat, but the top 12 counties with the highest rate of child poverty in the state of Ohio are in Appalachia. You all know, as experts in the field, the relationship between child poverty and adverse childhood experiences. And one fact in that Mind the Gap report, South Central Ohio, which is, of course, right in the heart of Appalachia, the highest percent of kids, 41%, exposed to 2 or more adverse childhood experiences. And you all know as well the relationship between those experiences and mental health issues and problems and emotional challenges. And the fact that they're in so many cases, the resources just simply don't exist, or they are unable to access the resources for whatever reason. And that one fact I just thought was tragic and really unacceptable and unconscionable, the fact that 2 kids with major depression do not get mental health care. I mean, that's just, it's shocking. And it's something that we all need to be concerned about. Everybody in Columbus should understand that and figure out what to do about it.
Thank you. So there's an incredible amount to unpack in those last 2 answers. And I guess, maybe just to hit on a few things you both highlighted. Certainly you both mentioned poverty and the lack of economic opportunity. And this is probably an unfair question, because if you could answer it, you would be the most brilliant people in the world. Is there a sense of what should happen to address that? Is there a route that we should be following to try to address the poverty, the lack of economic opportunity in the region?
You want to take that one first?
You're probably familiar with Ohio Southeast Economic Development. That's the Regional Economic Development Agency for this region, and that's really fortunate. I really commend the structure that's now been set up so that you have one of the 6 regional agencies focused on the economy in Appalachia. And clearly, you've got to do everything that you can to attract jobs and help companies here succeed and to grow, because that is a part of the answer to dealing with poverty. It is a long-term challenge for sure. From my standpoint, I mentioned how we tried to build out, and Ted did as well, the highway system here, physical highway system. But today, the broadband highway is just as essential as the physical highway. And it's fortunate the state is starting to work on this, but from an economic development standpoint and a mental health standpoint, it's critical. If every family would have access to high-speed broadband, I mean, the long-term impact would be, I think, tremendous. In terms of attracting jobs, we have remote work now increasingly across the country. Companies that could set up operations where they like access to high-speed broadband, but also the telehealth opportunities are tremendous as well.
I'll say amen to everything the governor has said in that response. Just let me say that I learned more about Appalachia when I was a congressman serving the area than I did as governor. Ohio's a big, complex, diverse state, and when you're a governor, you've got responsibility for the entire state, and I understand that, and every region has its own set of concerns and problems. But when I was a congressman serving this region, I had certain experiences that stay with me to this very day. I remember sitting with a family in Athens, Ohio, around their kitchen table. A husband, a mother, sister, who talked with me about the suicide of their son and brother. And I remember them saying to me, we tried as best we could to get him treatment that would last, inpatient treatment that would last more than 3 days. And it was a gut-wrenching conversation. These were wonderful people. And so what I believe when it comes to serious behavioral problems, that the young people in this region need appropriate inpatient treatment that does not require them to drive to Columbus, Ohio, and spend 3 or 4 days at the children's hospital. And quite frankly, there are people in my profession that don't always see that the way I do. But I understand that some problems, mental health problems, depression problems, and so on, need a treatment that is local and that is appropriate and extensive enough to deal with that young person's problem in a way that can be helpful to them going forward. I also think there needs to be adequate emergency care available and knowable. I talk to parents who may have a young person in their family that's struggling with a serious mental illness, everything from depression to schizophrenia. And if there's a crisis, they seem to be unaware of where they can go to get immediate help and intervention. And I think that's a problem that exists acutely in regions of the state where there is often lack of transportation and you have to go long distances to try to find the help you need. So, I think there's some very practical things that need to be done in the provision of appropriate, timely mental health services in those situations where there is a crisis that needs to be dealt with.
So, all that being said, very and in some ways intractable issues that we have to deal with. Do you have a sense of or thoughts about positive steps, very tangible positive steps the state of Ohio could take to positively impact children's behavioral health and well-being today?
Well, Dr. Laddie, I was talking with you very briefly before this session started. I have been an advocate throughout my political life in the full utilization of the resources available to communities. And I'm talking specifically about schools and school buildings, and the fact that we ought to utilize these publicly financed, taxpayer-financed resources for more than just, a school day. Evenings, weekends, I would just love to see the resources made available to have these school buildings become hubs of healthy activity for young people and for adolescents. And, there's a lot of mistrust in our society today, but I think people have a special pride in their local schools, whether it's the McDermott Fighting Tigers or, I don't know, the Otway Redbirds or whatever. People have a sense of pride and identity in their local schools, and I think we try to take advantage of that in those schools for mental health services, for recreational opportunities, for various kinds of activities, healthy activities, especially during that period of time when school was normally out and parents are sometimes not at home. And if we could find some way to really utilize our schools and our school buildings in the communities throughout Appalachia, I think that could provide a resource for young people.
I'm going to agree with my esteemed colleague. I would say that the Mind the Gap report that you just heard about does lay out some steps the state can do that are very important. The issue of insurance parity, real parity, the issue of reimbursement rates for mental health and behavioral health services under Medicaid and managed organizations are really important. George, who I admired, and after the Winovich Center is named after him, I heard him speak often, and he would say, if I had a magic wand, I would reconstitute the American family. Well, that's certainly a good statement. I have a different magic wand wish, though, from this standpoint, and this shows one of my biases that Randy knows about a lot. If I had a magic wand, I would place a well-trained clinical counselor in every school in the state of Ohio. Someone like Ted here. I'm involved with a program at Dayton Center for Application into the elementary and middle and high schools, Catholic schools in the Dayton area. And these folks are well trained, they're well supervised, they're kind of like a team, but there's one counselor full-time basically in each school, so they can do prevention programs, build a good atmosphere for the school, healthy atmosphere for the school. They can intervene with kids that have problems, in some cases counsel them, in some cases diagnose a more serious problem and refer that to counseling, and so forth. Now, in Dayton we do have the resources to be able to do that, and so that kind of begs the question, that's a magic wand issue for relations, because it goes right into the whole workforce challenge. But, and I give the current governor, a lot of credit for the health and wellness initiative, but I'm not sure how those funds are really being spent by school districts, but I'd like to see them, really direct those funds to placing trained clinical counselors in all of these schools to deal with these mental health issues and connect with the other systems. And short of that, I think the state can fund demonstration projects like the one in the Switzerland of Ohio School District. Anyone here from Monroe County? Probably not right now, but that's one big school district and like 536 square miles, 8 buildings, 30 miles apart. They got, one counselor. How do you cover it? So the state funded a demonstration pilot project for telehealth. Phase 1 provides spaces for providers to deliver care within each of the school buildings that are good, safe, compliant spaces and capable of live video and audio. Second phase connects that network remote office of the behavioral health provider partner, which is Southeast Healthcare Facilities. So students can then access care to remote offices beyond the immediate counselor in the school district. So this is a project that Randy's well aware of. We're working on replicating that in other school districts across Ohio with state support, but this is an example of what Governor Strickland was talking about in terms of really taking advantage of the resources that you have out there right now and spreading, kind of multiplying the efforts of the existing workforce, even how inadequate it might be. So I think it's a good idea. You folks for data from the state, that's very important. And I'd also like to see, and I think the state can fund this because nobody else wants to fund it, is good program evaluation so we know what's really working and we can spread what's working around the state.
Thank you. I'm going to, oh, go ahead. No, go ahead. Go ahead.
I want to speak to that, if I can, just briefly this time. I worked in Ohio's maximum security prison for over 10 years. I don't recall ever working with an inmate that had come from a healthy home. I'm sure there were exceptions, but the way we approach our children, they say that 90% of the human brain is developed by age 5. I don't know that that's the case or not, but a lot of people believe that that's the case. But we do know that those very early years are critically important to child's success. And so finding ways to provide those early educational opportunities. Universal pre-K would be a wonderful thing if we could achieve that in our state and in our country. I'm a big fan of nurses, and having nurses visit the homes after child's born, to follow up, to try to talk to that young parent or set of parents about the way to treat a young child, nurture a young child, and so on and so forth. I think parents need a lot of help, and sometimes parents don't do the right thing because they don't know to do the right thing. So, if we could find some way to have that kind of outreach in the early years of life, make sure that can get a healthy start. And of course, what the governor said here about broadband, it's a no-brainer. We are not going to have a healthy, growing economy in Appalachia without access to high-speed broadband technology. It's just not going to happen. And so it is so critical that that's something that's so practical. And then the last thing, let me say something about poverty. The best way to solve poverty is to provide money to people. And if they earn it, they can. But if they can't earn it, we've got to provide financial resources to families with children. We did that this past year during the recession. There was a lot of money that was provided, some people say it discourages people from working. I don't believe it does. But even if it does, we've got to understand that children who are living in families where there is a lack of resources, and find a way to do that. Jack Freck would say, you all know Jack Freck, many of you do, he'd say, give poor people money. Well, it's not quite that simple, but the idea is a solid idea that people have to have the resources in order to meet their basic needs. Otherwise, there is a negative outcome.
I'm going to just take a pause in the questions that I have. I do want to make sure there's time for people if there's things you want to bring up. take your questions, and I'll repeat them for the people online to hear, and then we can have the answers.
I mostly just wanted to make a comment to Governor Taft's
Actually, let's,
statement about needing more counselors in the schools. I want to say that our school counselors in this region are an untapped resource. We have a lot of school counselor programs like Ohio University or Dr. Tom Davis that are taken up accredited, and we're not utilizing our school counselors to deal with some of the prevention efforts that are needed in this school for the social emotional wellness. We have school counselors in this area in the high school and middle school level that are predominantly focused on testing and scheduling and those sorts of things, instead of the things that they're trained to do from these very phenomenal programs that we have. And so if some of these schools could have the capacity to have counseling staff, they're very well trained, they're trained on the level of counseling without the diagnostic piece predominantly. That
Could I ask a question to your statement?
Yes.
So what is the answer then? To have other personnel deal with the mechanical, the scheduling and all that?
Maybe Tom can speak to that, because I mean, I am not sure because I don't have an administrative degree, but I do have a counseling degree, and scheduling was never part of my program, but creating social emotional wellness opportunities and prevention opportunities and acute therapeutic interventions for, you know, just a short term to be able to help support the students was part of my program. And I graduated in 2002, so we've been doing this for a long time where we've been training our staff, and the American School Counselor Association recommends a student ratio, one school counselor to 250 students, and in this region we have some counselors who are dealing with upwards of 400 or 500 students on their caseload. So in addition to clinical mental health, which I've worked in school districts that have had clinical mental health present, and it is a great asset and resource, we can also stir up our schools by utilizing our counselors in their training to be used. Thank you.
Well, thank you. I can only agree with your comments. I certainly appreciate that, and I do think that trying to utilize what we already have, and I think to both of your positions relative to utilizing those community resources that we currently have is a good one. I cannot tell you, and I couldn't agree more, that probably the most underutilized resource that we have are our school counselors. I've sat in multiple meetings across the state where people tend to think about school counselors as we used to think about them 30, 40 years ago, where they were guidance people that really did. Their work was to push papers. That is not what we do in terms of training professional school counselors today. The licensed professional clinical counselors, and I know there are some of you in this room, can diagnose and treat mental and emotional disorders. There are only a couple of classes that school counselors are shy of being able to do exactly that. And, I think that a part of the challenge that we have is that schools are burdened with many tasks and responsibilities. But, that is clearly one area that I believe, and Randy's heard me speak to this, that I really do believe that we probably need some way to kind of think about how do we actualize that within the administration of schools, because that is, again, one of the problems. And oftentimes, we have school counselors who are doing jobs that simply are far below their training levels. That is such a shame. So anyway, I do appreciate you bringing that up, and it's something we need to keep pushing on, indeed. Thanks.
over here.
So I had mentioned that I am an early intervention specialist at Alexander Local Schools, which is one of the 5
I'm sorry,
schools.
what's your role?
I'm an early intervention specialist school led. At Alexander Local Schools, which is one of the 5 districts in Athens County. that has been designated as one of the 5 model districts in the state of Ohio, and we are the health model. And there are often people visiting us, so we are doing a lot of things right. And we do give, the administration, superintendent loves it when people come visit and see a lot of things that we're doing. I mentioned some of the programs that we have, that we house within. I didn't mention we have like a school liaison who is, what is children's services called nowadays? Yes. So we have someone who is housed within that is, it's all these community partnerships. So we have at least 3 Hopewell counselors that they have offices within our school district. Right. And so they deal with their own billing, but they do serve students who might otherwise not have counseling because their parents don't have the transportation to get them there. I see the counselor in the hallway, so, because her office is there, she's in our kindergarten preschool hallway. Every once in a while, I ask her a question. Hopewell also did a community partnership with all the preschool teachers where it's called the CARE program, and it was very intensive training for us, where we did it over time, and they came in and they modeled and they, prompted us and stuff. Now we can now with, our own students. So, constant like community partnerships, but we have addiction recovery services. We do have the Holzer Health Services that has a clinic. We did have after-school programs that were through Ohio University, but now that grant has went to Trimble, which is also needed. But our district, having worked with all of that, they are using some of those funds to have teachers, pay teachers to stay after for the red flag students, and work with. So we doing kind of our own program. So many different things. It's really kind of like a community center, in many ways. So we allow the community to access a lot of different things, like you were talking about. But again, if anybody is interested, I'm sure, like the administration, they give lots of tours. Our district did get the Momentum Award, I think, a couple times. So, the pandemic has made it struggling. We only had 44% of our families that could connect to broadband. We were trying all sorts of different things. In Athens, we had the difficulty with connecting families. So we are now dealing with the fact that there are, more students with anxiety disorders and all that stuff too. But it is a community partnership approach that we use, and so I just wanted to throw that out there.
That's a phenomenal model.
Yes, it really is. So and the part of it is the whole. Like when I was just talking about the stuff that I do with the nature, and I use community resources for that. There is a that the administration uses. So as teachers come or staff come and they're interested in this, it is a yes approach. So we have a whole bunch of stakeholders. Had to make sure maintenance, was involved in it, and all this different things, but there is a yes approach. So, and so that's part of it too, is having, kind of that mentality. In the state of Ohio too, like PACS is being implemented. There's the PBIS, and then there's now the PACS, and so there is I think probably, I know our district is doing it. I'm thinking maybe it's a state initiative that all districts are doing it, but there is a full-time PACS, which is positive behavior person that's now in our district, is also following. Gets so too. But what we do is we say, "Ooh, we like that," and then we utilize it. But there is a lot of that mentality towards that positive thing, and I know that I hear from teachers that it's kind of like, oh, here's another initiative, and it is true. It's difficult because we do things for 3 years and then we get a new initiative and all of that. But thinking about the how do those positive. And for me, I will be annoyed with all these initiatives if it really helps that teacher who doesn't know how to do that positive, because I can make such a difference in that kid's life if we give these teachers resources for that too. But anyhow, that's, anybody else?
That's great.
Any response? Or?
I just think it's a terrific model, and I think I have actually there.
Anybody else? I thought I saw a hand back earlier. No? I guess not. Okay. Well, I'm going to go back to my questions then. So let me just ask, to start to put a cap on all of this. You've got a room full of people who are here today because obviously they care about children and families and trying to make a difference. Is there any advice you would offer to those of us who care about the children?
Well, first of all, there's so many challenges it can seem overwhelming, but I do think this is a time of great hope and promise and opportunity. I think there's a greater awareness of the need for greater improved mental health and behavioral health care. I think you've got leaders in Columbus, at least in the executive branch, both the governor and the lieutenant governor, that are concerned about children, concerned about behavioral health, and prepared and broadband as well, which is all a very good thing. And I think, we're learning more about what we have to do. We've seen some really good statewide studies that you heard about today. Now the Children's Commission is going to be working very hard on all these problems and working with the local partners throughout the Appalachian region. So I think it's a time of great hope, but they say all politics is local. Well, all progress is really local too. So it's got to be, community by community. It's got to be, county by county. Some of the solutions are statewide, but in terms of opinion, close steps and knowing what's going on, the state's got to provide the information, but it's really up to you folks at the local level to get everybody together. And I know Randy's going to be visiting a number of counties and for really roundtables where you pull together, all the folks, the Adams boards, the ESCs, school districts, children's services, and so forth, and really have a discussion about what works, what doesn't, what are the gaps, what do we really need to do, because there are resources. States doing okay financially now. We've got these federal funds, but it's so important to spend those in the right way. And, what does a governor know? They know what you tell them. What does your legislator know? They know what you tell them. And so it's important to develop that local strategy and then to communicate and to build that relationship with your elected officials to make sure that they come and visit your programs or your offices and they know what's going on, and educate them, because everybody's trying to educate them about a million issues, and you folks need to build those local contacts that'll make a difference ultimately in what happens in Columbus.
First of all, Randy, thank you for inviting us, and thank you for staying and listening to what we had to say. I think the problems are difficult. They really are, and we need practical solutions. So just listening to what whole manner, I think, is important, and recognizing grinding effects of poverty on families and on children, and just having an awareness and an understanding of what that does to a family and to a young person. And so engaging families as much as possible, I think is important to the behavioral health, mental health, physical health of children. I believe that a lot of parents right for their, but may not know exactly what that is or how to do it. And so, and the last thing I'd say, I'd go back once again to how we utilize the resources that are available and how, especially our schools, and try to use, the mechanism of our educational system to deal with so many of the problems that that young people have in the region. And then the transition. Orman Hall is here, and Orman and I had a talk earlier today about an issue that, Governor, you're probably aware of. I wasn't. That the percentage of license revocations in Ohio is second, percentage-wise, second only to Iowa?
Kansas, I believe.
Kansas. There are hundreds of thousands of people in Ohio other than non-payment of child support who've had their license taken away from them, the mechanism they need to be able to get a job in order to pay their child support. And just issues like that, just practical issues that could be dealt with. People who don't pay child support should be penalized, but we ought to find some way to do that other than to take away their ability to get a job and earn a living so that they can pay their child support. So there's a lot of issues and a lot of smart people who are concerned, but that's just one little issue that I think that could have an impact upon a lot of families who live in our part of Ohio, where you can't walk to work and you can't get a bus to take you to work. If you don't have a car, you can't get to work and you can't work. And the same thing is true. I'm going to tell a story just quickly. I was driving from, some of you have probably heard me tell before, I was driving from a cold, wintry morning, snowy morning, and this guy was hitchhiking. And so I normally don't pick up hitchhikers, but under the circumstances, I chose to. And he got in the car, and he said, "Thanks for stopping. Most people don't stop nowadays, but I understand why." And so I engaged him in conversation. And he said, I just got out of prison. And he said, "I'm on my way to drug treatment. If I miss me out of the program. I haven't missed any yet. I'm going to be late this morning." And there's this guy walking from Nelsonville or hitchhiking from Nelsonville to Athens to go to drug treatment. And I'm thinking, God, life is hard for some people. It's hard for a lot of people in our region of Ohio. And we just, we need to recognize that. And a lot of the policymakers need to recognize that as well.
Given as reason for hope for the region as well. And I just want to say a couple things in wrapping up. The fact that people like Governor Taft, Governor Strickland, Tracy Plowk, Orman Hall, people who really have spent a good part of their lives as leaders in the state in terms of driving policy and investment in kids, have taken such an interest in our region, I think is a real resource for us. And I'm just so honored that people have said, I want to commit myself to trying to make a difference in this region. I also want to call out Tom Davis, who stood up. I don't know, some of you may not know Tom or why this guy stood up over there, but Tom and I were colleagues at Ohio University for a lot of years, and we both have retired and moved on now. But Tom really was one of the few people who had the idea and the vision behind the Appalachian Children Coalition and creating some momentum around better serving and meeting the needs, the behavioral health needs of children in the region. And Tom's been a a true visionary region. I want to for everything he's done. A final thanks. You know, as a guy who last May drove in a van, 7 and 10-year-old grandkids driving to Florida in a van whose air conditioner stopped working in Lancaster about 10 minutes before one of the grandchildren threw up in the back seat. I just want to thank both of you for what you did on the roads of this region. It shortened up the trip just a bit. I thank you for that. Yeah, so it was it was not funny. it was brutal. But anyway, but again, it's not my therapy session. So just take thank you for your attendance and your participation today and your commitment to children in the region. I hope the day was helpful. This was I mentioned several times, our first attempt at something like this, and really all we wanted was to do something that would bring some valuable information to all of you. So I thank you for coming. I ask you to be as honest as you can be on the evaluation forms. Let us know what you liked. Let us know what could have been better. And we look forward to doing more of these in the future. And also just to say that both the Appalachian Children Coalition and the Ohio Alliance for Population Health both stand ready to link with you on any you want to develop. I kind of think we're at a time, if there's a reason for hope, when there are resources out there and the people who have the good ideas and find a way to get those ideas in front of people really can get a lot of things done. So be sure to access either or both of our organizations if we can help you in that. So with that said, thank you, governors, and I hope you all have a great weekend. Thank you.
It was fun. Always a pleasure. Good to see you.